to Dr. Christos Christou, International President, MSF. Good to have you back again, Dr. Christou. Let me just ask you the question that I asked you at the outset, that as an organization that's been literally fighting at the front lines of actual war, how is this challenge of fighting a global pandemic different for MSF?
First of all, thanks for the invitation and for giving us this opportunity to present a little bit of what we are doing, and especially what we are doing the last months since the pandemic started. As a big medical humanitarian organization, our first priority was, of course, to maintain the already existing activities, to make sure that all programs are running smoothly and all essential services are still provided to those that they are more in need. And that was not an easy task at all, as we understand. On top of this, of course, we have launched new activities in direct response to the pandemic. In some countries, we have had to repurpose our projects and stuff, including some temporary closures of projects, so that we can focus resources on emergency preparedness and scale up where we can. We have an accumulated experience in outbreaks, with the most recent one in the Ebola outbreak, and not just this, that we would like to share with everyone. And you may have noticed that a couple of our interventions were in very deep, well-developed countries with very much sophisticated systems. However, it was important even there to provide some experience that we have. And on top of this, of course, also to make sure that the most in need, the most vulnerable people will always enjoy the essential services. So you see projects in Europe, you see projects in the United States, in Canada, and of course in all other places where we traditionally operate.
Dr. Christou, what has, for the benefit of our viewers, Médecins Sans Frontières been doing internationally? What challenges have you faced as an organization in meeting patients' needs and adapting to new circumstances?
The key challenges that we faced since the beginning and we're still facing are how to better mobilize our staff and our supplies. And indeed, we still also need the essential equipment. We need the PPEs, the famous PPEs, because without the PPEs, we cannot provide the safety that all our healthcare workers need in order then to treat the patients. So PPEs, the mobilization of our staff, the supplies that they cannot move from one place to the other due to several different restrictions in the traveling between the countries are the priorities. And of course, with this, another priority for us is to make sure that all the other patients, all the other needs, all the other diseases that they were always existing will not be just evaporated because of COVID. All these needs will still be addressed to these people. And this is a huge challenge as well.
Doctor, you yourself are an emergency trauma surgeon. What role can MSF or other medical humanitarian actors play in global health emergencies today, and how can people support them?
That's a very good question, because it is an emergency. It is one of the emergencies that no one really knew what to do. We're still learning. So one of the things that we have to do is to pay much attention to the evidence, to the scientists, and understand exactly what science wants to tell to us. How this is interpreted into action, this is where also humanitarians and medical humanitarian organizations like the Médecins Sans Frontières, the Doctors Without Borders, that they have huge experience, can help also the others, reminding that this is just a crisis within other multiple crises, and we have to really look at the populations, understand their needs, and adjust every solution that we want to give based on the need and the particularities of each context and each population. And we are very willing to do that, because we want to remind to everyone that the needs are many more than anything related to COVID. Babies will still be born, vaccines will still be required, the need for life-saving treatment will not disappear. We have victims of wars, we have malnourished kids that still need our help. We have reproductive health services that need now even more than ever. And in all these things, I think MSF can, of course, not fulfill all the needs, but can be there and remind that it doesn't matter that much only how much people have been infected by COVID, but also how much they will be affected by this in all different neglected corners around the world.
Right. Okay, Dr. Christou, thank you very much indeed for joining us. And just to remind our viewers that you can contribute to the frontline workers of MSF. The details of how you can do that are on the screen constantly.